Welcome to the AACS Daily News. In addition to the physical health risks, the coronavirus pandemic has added a lot of mental stress to people's lives. There may be additional stress as communities across the state prepare to begin the school year, either in person or remotely. Local psychotherapist Diana Holmes offered some tips on how to maintain your mental health.
Hi, I'm Diana Holmes, and I'm a licensed clinical social worker. I want to thank AACS for highlighting this important topic. We're here today to talk about mental health and how this new routine in September is going to impact our children. One of the things that I really want to highlight right now is the importance of self-care. Parents often forget about the importance of caring for themselves during these challenging times. It's important that you always focus on getting sleep yourself, getting rest, getting your routine into a solid place. So self-care is very important. Having a routine and being able to have some structure yourself will be able to provide that for your children as well. It's important for them to also have structure, but the routine and self-care has to be part of your daily life. This means things that you enjoy. Trying to find joy in a TV show or a special element of each day will really help you to be able to provide the care for your children. The second thing that I'd like to focus on is modeling calm behavior in front of our children. Remember, they're also going through a challenging time right now, and we want to make sure that we remain calm in front of them. If parents are experiencing anxiety, which many of us are, it's important to reach out to your own supports, and that could include a mental health professional. But we don't want to model that behavior in front of children. This is only going to increase their anxiety and make them feel more nervous. So what we want to always do is just have an open ear and be active in our listening skills. We want to hear from them what their concerns are and also put them at ease, which can be challenging right now. Remember, they're going through some challenging times as well. Some may be learning completely from home, remote. Others may be using the hybrid approach and only seeing their friends and teachers half time. And remember, even that comes with certain challenges in terms of the protocols at schools. We want to be understanding that they're also experiencing something. They also may be having different individuals watch them because parents are working. That's a different challenge that they also have to cope with. One other area that I'd like to focus on, which I've already mentioned, is the importance of having a routine. It may be challenging because we don't exactly know what the fall schedule will look like, but it is important that the wake up and bedtime routines remain stable. This means for parents and children. We want to eat regular balanced meals and also include exercise in some sort of routine for children and ourselves. This will help us build that foundation for a good mental health. As a clinician, one of the busiest times of year is actually around the end of September. This usually is related to fall schedules in full swing and parents and children feeling overwhelmed. I'm noticing that people are already reaching out in late August due to the fall schedule. People are already experiencing anxiety and depression in general based on what's happening right now. Again, it's all the more reason to reach out if you're needing to. It's important to keep in mind that there could be many warning signs. As parents, we should really be focused on them. One of the areas that I'm noticing is that kids are often isolating. They're going to their bedrooms and maybe on social media or even playing video games. We could think that we're getting a break from them, but in actuality, this could be very damaging to them. We want to make sure that they remain engaged in the world and in their life. This means making sure that we're limiting the time that they're on social media, limiting interactions with technology, and getting them outside if we can, or some sort of physical activity. I would encourage people to reach out if they need to. This means if they have a physician or they already have a mental health professional to certainly reach out. Many of us are offering telehealth, phone sessions, or in-person sessions if people do feel comfortable. It's important to get the support you need. People can also visit Psychology Today and look up their zip code to figure out which clinician would be in their area. Please, always reach out if you need support or help.